Today, let's talk about knee osteoarthritis. This is something Western medicine has long recognized, but as we've discussed recently, we tend to use the terminology of Western medicine in our daily practice. However, in the clinic, we also need to approach it from a traditional Chinese medicine, TCM, perspective. Knee osteoarthritis is generally considered a degenerative condition, often associated with aging. Unless there has been some trauma, it is primarily a disease of the elderly. Let's focus on the traditional Chinese medicine approach. How should we treat knee osteoarthritis using TCM? The clinical manifestations are complex. It's not just a simple case of knee pain. Some people experience pain along with a sensitivity to cold, while others may not. Some patients might have local swelling, while others don't. In the clinic, it's important to consider the gradual nature of knee osteoarthritis. Over time, the condition may cause joint deformity. For example, some people may develop O-shaped legs or S-shaped legs. Interestingly, even though deformity may occur early on, symptoms may not be very noticeable at first. The condition progresses slowly, step by step. When treating knee osteoarthritis, we must address a few key points. First, remember that this condition is closely tied to aging. From a TCM perspective, as we age, there's typically a decline in the body's overall vitality. One of the most important factors is kidney and liver deficiency. We know that the kidneys govern the bones, and if the kidneys are deficient, bone deformity is likely to occur. In TCM, the liver is associated with the tendons. Liver blood deficiency or liver yin deficiency can lead to weakened tendons and muscles, contributing to conditions like knee osteoarthritis. Similarly, kidney yin or kidney yang deficiency can also affect the skeletal system. So, what does this mean for the knee joint? From a TCM standpoint, a deficiency in liver and kidney energy, along with blood stagnation, can lead to inflammation and degeneration in the knee joint. This is where we see changes in the structure and function of the knee. In summary, knee osteoarthritis is a complex condition with both structural changes and underlying deficiencies that need to be addressed from a holistic TCM perspective. Treatment should focus on nourishing the kidneys, liver, and blood, as well as improving circulation and addressing any inflammation. Since knee osteoarthritis is a gradual condition, the decline in human physiology is also gradual. In many cases, the symptoms may not be immediately apparent, and not everyone experiences symptoms. When symptoms do occur, they may be more noticeable or pronounced under certain conditions. Although liver and kidney deficiencies play a significant role in the development of these symptoms, changes in the knee joint only become obvious after certain triggers, such as cold exposure, fatigue, or trauma, cause them to worsen. The severity of the symptoms often depends on factors like overexertion from excessive walking or prolonged standing. It's important to note that individuals have different constitutions, so their symptoms may vary. In traditional Chinese medicine, TCM, we pay close attention to the patient's foundation, their basic constitution, when diagnosing and treating this condition. This foundation helps guide the treatment approach, which may involve strengthening the liver and kidney, among other things. In addition to liver and kidney deficiency, other factors may also contribute to knee osteoarthritis. For instance, some individuals may experience symptoms related to cold and dampness, or the stagnation of damp heat, or even phlegm accumulation. These variations highlight why we cannot treat knee osteoarthritis with a one-size-fits-all prescription. Instead, we must take a dialectical approach based on the patient's individual condition. For example, if a patient presents with only one knee joint affected, the diagnosis may indicate osteoarthritis with narrowed joint space and bone spurs. The pain may worsen with prolonged walking, but not necessarily due to cold or heat. In such cases, the primary focus of treatment should be nourishing the liver and kidneys, since this will help address the root cause of the deficiency. If the patient does not have a marked sensitivity to cold, but experiences pain after walking for extended periods, and the knee joint is not swollen or excessively warm, the approach remains focused on nourishing the liver and kidneys. For this, we may use herbal remedies that tonify both the liver and kidney. Now, what if there's an additional deficiency of liver blood or kidney yin? In cases of kidney yin deficiency, we would add herbs that nourish the kidney, such as shu di huang, Rehmannia root, and for liver yin deficiency, we might add shaoyao, peony root, to the formula. In cases where both liver blood and kidney yin are insufficient, we would use a more comprehensive tonic, like Li Wei Di Huang Wan, which is well known for tonifying both the liver and kidney. Ultimately, the treatment approach depends on the specific symptoms, constitutional factors, and the underlying deficiencies present in the patient. Thus, TCM emphasizes a personalized, dialectical treatment plan rather than a one-size-fits-all remedy. When liver blood is insufficient and kidney yang is deficient, we might use right tortoise leaf or right tortoise pill to help promote balance and nourish the liver and kidneys. The primary goal in this case is to address the intolerance to pain, which can be quite severe. If the pain is unbearable, it's crucial to treat the root cause and focus on supplementation. If the disease has progressed over a long period, we may also add blood-moving herbs or remedies to help improve circulation. However, we should be cautious not to use overly strong or excessively active formulas. The focus should always be on gentle nourishment and supplementing the deficiencies, particularly in the liver and kidneys. In acupuncture, when patients come in for treatment, we often use local acupoints to target the knee joint directly. However, if the effects are not satisfactory, we need to ensure that the acupuncture treatment aligns with the principles of traditional Chinese medicine, particularly focusing on nourishing the liver and kidneys. For patients with liver and kidney deficiencies, the main goal is to tonify these organs. In TCM, we know that the liver and kidneys are closely related to the bones and tendons, so we must address both the root and the manifestations of the condition. When treating the knee joint, we are focused on restoring the underlying deficiencies through acupuncture and herbal remedies. When using acupuncture for liver and kidney deficiencies, we can focus on specific acupoints like Tai Chi and Tai Chong to strengthen the foundation and address the root cause. These points are essential for nourishing the liver and kidney, as well as boosting overall vitality. Additionally, Zusanli ST36, located on the stomach meridian, is often used because it invigorates the spleen and nourishes qi, helping to support the body's overall energy. Yinling Quan SP9, an acupoint on the spleen meridian, is also useful for tonifying the spleen and qi. In cases where musculoskeletal weakness is present due to liver and kidney deficiency, acupoints like Yanglingquan GB34 are particularly effective. This point can help relieve pain and improve the function of the tendons and muscles, which are directly influenced by the liver. Another important acupoint is Liangshu ST34, which can be used to target local pain and improve circulation in the knee joint. Acupuncture treatment should always be comprehensive. While local acupuncture points can offer some relief, they may not provide long-lasting effects unless the treatment also addresses the root cause of the deficiency and promotes overall energy balance. For patients who experience severe pain, especially when walking or going downstairs, we might add corresponding points that are linked to the affected area. For instance, we could use microneedle therapy or water surface theory points, which can provide more immediate pain relief by stimulating deeper pathways in the body. In summary, the treatment of knee osteoarthritis in TCM involves a multifaceted approach that combines herbal remedies, acupuncture, and physical therapies. The focus is always on nourishing the liver and kidneys, improving circulation, and addressing both the root and the symptoms of the disease. With consistent treatment, the effects can be long-lasting and supportive of overall health. In treating knee osteoarthritis, we must first carefully analyze the patient's symptoms. For instance, if the pain is localized and only affects a specific area, such as the medial aspect of the knee, we often follow the meridian pathways, targeting the corresponding acupoints. Acupuncture, in this case, can be highly effective. By adjusting the needle according to the pain, we align our treatment with the body's energy flow, ensuring a targeted approach. However, if the pain is due to liver and kidney deficiency, which often presents as discomfort after prolonged walking, we need to consider the underlying causes more deeply. But when the symptoms are accompanied by swelling, redness, and heat, indicating local inflammation, such as bursitis or synovitis, we may face a more complicated case. In Western medicine, this might be identified through an MRI, revealing inflammation, but in traditional Chinese medicine, TCM, we would diagnose based on the specific patterns of symptoms. In this scenario, the patient might experience knee pain along with a sensation of heat and swelling, yet still show signs of cold intolerance. This is a classic case of kidney yang deficiency combined with damp heat stagnation. In TCM, this combination is treated by addressing both aspects, nourishing the kidney yang while simultaneously clearing damp heat. In clinic practice, we often begin by treating the damp heat symptoms first. This can be achieved with herbal formulas like yang he soup, which warms the kidney and tonifies yang, effectively addressing both deficiencies. If phlegm is present in the knee joint, such as in cases of synovitis or bursitis, we may incorporate herbs like masona, a specific herb for reducing phlegm, which helps clear phlegm from the body. It's important not to remove the inner white membrane of the herb, as it has the effect of clearing heat and dampness from the joints, providing effective treatment for localized swelling. In addition to herbal treatment, acupuncture plays a critical role. When treating damp heat or cold damp conditions, we must be careful to avoid techniques that exacerbate the problem, such as moxibustion, which can add heat to an already heated condition. Instead, we focus on clearing damp heat from the lower jiao, lower body, which is a common site for such stagnation. Points like bladder 23, shenshu, and bladder 40, weishong, which are associated with clearing dampness, are crucial for resolving these issues. For cases where cold and damp are the predominant symptoms, especially in patients who experience cold intolerance in the knee joint or need to cover their knees even in summer, we focus on nourishing the liver and kidneys. This helps strengthen the yang and dispel cold and dampness. We may also add acupuncture points like Tai Chi and Tai Chong to promote kidney yang and San Yin Jiao to tonify the spleen and support overall energy flow. For patients with liver and kidney deficiency combined with cold and damp, we treat by tonifying the kidney yang, clearing cold, and dissipating dampness. This approach helps balance the body's internal environment and restore proper energy flow, which can ease the discomfort in the knee joint. Additionally, we may recommend using moxibustion at specific points like Qihai CV6 and Guanyuan CV4 to nourish the kidney yang and further strengthen the body's defenses. In conclusion, when treating knee osteoarthritis with liver and kidney deficiency, cold, and dampness, the key is to nourish the kidneys, warm yang, and clear damp heat. Acupuncture, along with the correct use of herbal remedies, can provide relief from pain and swelling while addressing the root cause of the disease. By focusing on the yin-yang balance, we can ensure long-term therapeutic benefits. When treating knee osteoarthritis, there are 3 primary patterns we typically encounter. These patterns cover the majority of cases, but not all cases will fit into these categories perfectly. Let's go over the key points. Long-term illness with accumulated stagnation. For patients who have been suffering from knee osteoarthritis for a long time, there will inevitably be stagnation in the meridians. In these cases, We must pay special attention to using blood-moving and qi-regulating herbal formulas to help clear this congestion. Chronic cases often lead to the buildup of phlegm and stagnant qi, so we focus on resolving this with appropriate treatments. Joint deformity and swelling. If the knee joint has undergone long-term deformation and there is noticeable swelling, we often see phlegm involvement. In such cases, it's crucial to resolve the phlegm and clear the dampness. We use herbal remedies that focus on reducing phlegm and improving circulation. The white ring Mizona herb is particularly useful for clearing phlegm, as it helps peel away the phlegm both internally and externally, reducing its buildup. Systemic treatment and comprehensive care. For all patients, the treatment should be systemic, not just focused on the knee joint. The underlying liver and kidney deficiencies, or cold-damp conditions, should be addressed through comprehensive therapy. It's important to remember that we cannot rely solely on localized treatments. In addition to these internal treatments, we can incorporate external therapies to aid in the healing process. Topical remedies. We can use herbal plasters or poultices to apply directly to the knee joint. A common method involves preparing a herbal soup, soaking a cloth bag in it, and then steaming the bag. After it cools slightly, place the cloth over the affected area. This method helps to alleviate pain and ease inflammation. Physiotherapy. If there is swelling or exudation, we can use methods like ultrasound or light therapy to aid in inflammation absorption and promote healing. These therapies can effectively reduce pain and swelling, providing much-needed relief. Another commonly used technique in the clinic is applying heat to the affected area. After preparing the herbal treatment, we can use a warm compress or heat lamp to provide sustained warmth, helping to increase circulation and alleviate stiffness. However, it is essential to avoid burns, especially in patients with diabetes or poor circulation, so always ensure the temperature is comfortable and safe for the patient. For those with cold and damp conditions or liver and kidney deficiencies, moxibustion can be an effective treatment. Moxibustion warms the area and helps dispel cold and dampness, promoting better circulation. However, this should be done carefully and should complement other treatments like acupuncture or herbal medicine for the best results. In conclusion, knee osteoarthritis requires a multifaceted treatment approach. By addressing both the root cause, such as liver and kidney deficiencies, and the symptoms, such as pain, swelling, and inflammation, we can provide long-term relief for patients. A combination of acupuncture, herbal remedies, external therapies, and physiotherapy will ensure a comprehensive treatment plan tailored to the individual's needs.